there's been a high volume of physicians that are quitting medicine lately.
And some of the reasons listed for quitting have included 1. Physician burnout.
Burnout is a psychological syndrome emerging as a prolonged response to chronic interpersonal stressor on the job. Normally, I equate burnout to global warming, that is localized to an individual. Burnout is characterized by 3 dimensions. 1. High emotional exhaustion. 2. High levels of depersonalization. And lastly, feelings of reduced personal accomplishment. In high-income countries such as the US, the prevalence among physicians is equated to be as high as 70%. And in sub-Saharan Africa, where more than 30% of physicians have migrated to high-income countries, resulting in a shortage of healthcare providers, physician burnout has equally skyrocketed. The ones left behind are forced to care for a disproportionate greater number of acutely ill patients. In a research done among physician anaesthetists in South Africa, residents in Nigeria and physicians in Ethiopia, the results were as shown. Burnout is highly comorbid with depression, anxiety and other psychiatric conditions. Other detrimental effects to the physicians include reduction in gray matter volume of anterior cingulate, caudate and putamen, which fine-tune voluntary movements, and are involved in learning, memory, motivation and emotion. Physicians also self-reported that burnout negatively impacted on the quality of patient care and functionality of healthcare systems. The incidence of medical errors also increased with a reduction in time devoted to providing clinical care. Medical errors tend to increase the length of hospital stay and also increase the cost of healthcare for the patient. There is also a risk of patient disability or even death. And lastly, this may also impact physicians' professional status, confidence, and practice. Interpersonal and professional conflicts, that is between doctors, doctor-nurse conflicts and work-family conflicts, have also been cited as consequences of burnout. The end result has been many doctors expressing dissatisfaction and the intention to leave the profession.
Do you sometimes feel emotionally drained at the end of the day, and sometimes when you get up in the morning, you dread having to face another day at work? In simple terms, that is burnout.
Grace MD at Doctors Front.